Welcome. Today we're diving deep into a common and serious kid disorder, acute tubular necrosis, often called ATN. ATN is a condition where the small tubes in your kidneys, called tubules, become damaged or destroyed. These tubules play a crucial role in filtering waste and maintaining fluid balance. When they fail, it can lead to a rapid decline in kidney function, potentially life-threatening complications. Join us as we explore the causes, effects, diagnosis, and treatment of this critical condition. So, what causes acute tubular necrosis? ATN typically arises from two primary sources: ischemia and nephrotoxicity. Ischemia refers to insufficient blood flow to the kidneys. This can be triggered by severe hypotension from things like septic shock, major surgery, heart failure, or significant blood loss. Without adequate blood supply, the kidney cells become oxygen-starved and damaged. Nephrotoxicity, on the other hand, involves kidney damage caused by certain substances. Common culprits include certain antibiotics, like aminoglycosides, non-steroidal anti-inflammatory drugs or NSAIDs, contrast dyes used in imaging procedures, chemotherapy drugs like cisplatin, and even heavy metals like lead and mercury. These substances can directly poison the tubular cells, leading to their destruction. Less common causes involve infections like sepsis or conditions like rhabdomyolysis, where muscle breakdown releases substances toxic to the kidneys. Let's delve into the pathophysiology of ATN. Whether the damage stems from ischemia or toxins, the initial event is cellular injury to the tubular epithelial cells. In ischemic ATN, the lack of oxygen leads to cellular swelling, disruption of cell membranes, and ultimately, necrosis, cell death. With nephrotoxic ATN, the toxins directly injure or poison the tubular cells. As these cells die, they slough off and obstruct the tubules. This blockage raises pressure within the kidney, further impairing filtration. Damaged tubules also become leaky, allowing essential electrolytes and fluids to escape. The reduced filtration and disrupted tubular function lead to a build-up of waste products like creatinine and urea in the bloodstream, causing azotemia, a hallmark of kidney failure. The kidney's ability to regulate electrolytes like potassium and sodium is also compromised, leading to imbalances that can affect heart function and overall health. Now let's consider the epidemiology of ATN. ATN is a fairly common cause of acute kidney injury, accounting for a significant proportion of cases, especially in hospitalized patients. The specific incidence varies depending on the population studied and the definition used for acute kidney injury. Individuals at higher risk include those with pre-existing kidney disease, the elderly, and those with conditions that compromise blood flow, like heart failure or sepsis. Patients undergoing major surgery, particularly cardiac surgery, and those receiving nephrotoxic medications are also at elevated risk. While anyone can potentially develop ATN, recognizing these high-risk groups is crucial for preventative measures and early detection. What are the telltale signs and symptoms of ATN? The symptoms can vary depending on the severity and the underlying cause, but the most common initial sign is a decrease in urine output, a condition known as oliguria. As kidney function declines, patients may experience fluid retention, leading to swelling in the legs, ankles, and feet. The buildup of waste products in the blood can cause fatigue, nausea, vomiting, and loss of appetite. Electrolyte imbalances can lead to muscle weakness, cramps, and even heart arrhythmias. In severe cases, patients may experience confusion, seizures, or coma. It's important to remember that some individuals, especially in the early stages, may have few or no noticeable symptoms, highlighting the importance of regular monitoring in at-risk individuals. So how is ATN diagnosed? The diagnosis typically involves a combination of clinical evaluation, blood tests, and urine tests. A physician will take a thorough medical history to assess risk factors and possible causes. Blood tests are crucial for measuring kidney function, including creatinine and blood urea nitrogen, or BUN. Elevated levels of these waste products indicate impaired kidney function. Urine tests can help identify abnormalities, such as the presence of tubular cells, protein, or casts. Additionally, the fractional excretion of sodium, or FINA, can help distinguish ATN from other causes of acute kidney injury. In some cases, a kidney biopsy may be performed to confirm the diagnosis and rule out other kidney disorders. Imaging studies like ultrasound are often used to rule out structural problems or obstruction as the cause of kidney failure. While ATN is generally classified by its cause, ischemic or nephrotoxic, it can also be characterized by the stage of the acute kidney injury. The RIFLE criteria, ATN classification, and DIGO guidelines are systems used to classify the severity of acute kidney injury, including ATN, based on changes in serum creatinine, urine output, and kidney function. These classifications help guide treatment and predict prognosis. What is the treatment and management of ATN? The primary goal of treatment is to support kidney function while addressing the underlying cause. If ischemia is the culprit, restoring adequate blood flow is paramount. This may involve fluid resuscitation, blood transfusions, or medications to raise blood pressure. If nephrotoxicity is the cause, the offending substance must be discontinued immediately. Dialysis, either hemodialysis or peritoneal dialysis, is often necessary to remove waste products and excess fluid from the blood, especially if the patient is severely symptomatic or experiencing electrolyte imbalances. Careful monitoring of fluid balance, electrolytes, and blood pressure is essential. Nutritional support is also important to provide adequate calories and protein while minimizing the burden on the kidneys. Medications may be needed to manage specific complications such as hyperkalemia, acidosis, or fluid overload. How can we prevent ATN? Preventing ATN involves identifying and mitigating risk factors. For individuals at risk of ischemia, ensuring adequate hydration and managing underlying conditions like heart failure and diabetes are crucial. When using nephrotoxic medications, it's important to use the lowest effective dose, monitor kidney function closely, and ensure adequate hydration. When contrast dyes are necessary for imaging studies, using low osmolar contrast agents and pre-hydration can help reduce the risk of kidney damage. Avoiding the use of multiple nephrotoxic agents simultaneously can also lower the risk. Early recognition and prompt treatment of infections like sepsis can prevent kidney injury. By taking proactive measures, we can significantly reduce the incidence of ATN. What is the prognosis for ATN, and what are some recent research advances? The prognosis for ATN varies depending on the severity of the kidney injury, the underlying cause, and the presence of other medical conditions. In many cases, kidney function can recover, especially if the underlying cause is addressed promptly. However, some individuals may develop chronic kidney disease, requiring long-term dialysis or even kidney transplantation. Recent research focuses on developing new biomarkers to detect kidney injury earlier and more accurately. Studies are also exploring novel therapies, such as stem cell therapy and regenerative medicine, to promote kidney repair and regeneration. These advances hold promise for improving the outcomes of patients with ATN in the future.